Mr. Miller. My name is Izzy. I'm a Dear Student Nurse from Purdue Northwest today. First, can I confirm your name and date of birth?
Stephen Miller, February 20th, 1966.
Perfect. And then, do you have any allergies to any iodine or latex at all?
I'm actually allergic to iodine.
Okay, perfect. Thank you for letting me know. So, are you in any pain currently?
No.
Okay. So first, I'm just gonna raise this bed a little bit.
What are you talking about?
Today, I'm gonna be inserting a urinary catheter just to get the urine flowing and make it easier to relieve some pressure since you are using the bathroom. Okay. First, I'm just gonna be cleaning the area quickly before we start. Are you doing okay so far?
Yes.
Okay. I'm just gonna, could you just spread your legs a little bit for me? Thank you. Place this underneath. I would have already filled this with some water. Around. And go down. Okay. And I would dispose of this properly.
Yeah, you take your receptacle out,
I would
right?
dry the area by patting it down.
Yeah, so you're taking your receptacle out. You're putting it out.
Okay. And I would also dispose of this in the linen, in the dirty linen container. Take off my gloves really quickly. Okay, Mr. Miller, I'm just gonna get our area set up to start with the catheter.
Yeah, so you're just take the entire.
Take everything out.
Yeah, just take everything out. Undo the.
First, I'm gonna pull this down a little bit.
Yeah. Take that
Make it a
out.
little easier.
And touch it with the glove before, so there's a model, sterile. And then,
I'm just gonna roll this up. Place a little bit of a makeshift trash bag right here, just so I can throw out whatever I need to during this procedure. Open it up.
Well, not yet, so after you have everything, you know, the catheter's all looped up and it's the receptacle tray, and you take your non-dominant hand, please don't do this.
Make sure my environment stays sterile.
And then take the cotton.
And I'm going to put on my sterile gloves over here.
Use your dominant hand to inflate the catheter and then inject the nerve volume with sterile water.
Then I would dispose of that. Now I'm going to get the area set up. So first I'm gonna place this,
Then screw the catheter.
put the shiny side down.
Yeah, just put the, yeah, throw it away and then put the, that.
Same this one. Lastly, I'm just gonna cover you with this. Still doing okay?
Yes.
Or leave it, honestly, if that's.
Bring it over.
Kind of silly, like, you get the idea.
And then first I'm going to
Just in the real world, obviously,
take
you
this
do
cap
that.
off and place it into here.
I know it's something, okay, so pretend, okay, so yeah, so pretend it's new, and verbalize that.
And then I would dispose of the iodine since he is allergic to it, and I would just use the hydrogen peroxide. And then I'm going to fluff my cotton balls. Set that there. And put some hydrogen peroxide on top of them.
So, you would put, a chunk
Okay.
down.
And then I would open up my lubricating jelly and place it over here. Dispose of that. And then gonna take the top off the catheter. Dispose of that. I'm gonna place that in the lubricating jelly, about 5 to 7 inches. Okay, Mr. Miller, I'm just going to clean the area very quickly. And then I would go around and I would dispose of each cotton ball each time I use it.
Take your gloves off, hand sanitize, put the blanket back on,
Okay.
before you do anything else.
Okay. Fix that. All right, Mr. Miller. Now I'm going to begin to insert the catheter. Do you need any anesthetic gel or any numbing stuff before we start?
No, I'm all good.
All right, here we go.
Okay, perfect. So I'm going to have you bear down, take some deep breaths. This might be a little bit uncomfortable. So I would insert it about 7 to 10 inches. And then I would see urine start to flow down the catheter. So I know to keep going. Keep taking some deep breaths, okay? I would insert it to the Y, and if it did get stuck, I would rotate it a little bit to keep going. Perfect. Are you still doing okay?
Yes.
Okay. So now I'm going to inflate the balloon. Making
Yeah,
sure
I
not
would
to
take it.
tug
Actually, that's a
or
good
touch
idea.
anything with
Fake
my
it. That's what Professor Edwards did.
non-dominant hand.
Just fake it, yeah, fake it. No, it's too.
Place
Yeah.
this bag over here.
Good call.
And then I would tug on the catheter to make sure it's in place once I can't pull anymore. And
You
then
watch your videos.
now I'm going to clean everything up.
You did?
But I'm going to take the syringe out since I will need it. I would actually dispose of it in a sharps container, but since I will need it for when I remove the catheter, I'm just going to place it over here for right now. So,
No.
dispose of everything.
Ooh, we discussed after it.
Take off my gloves. To remove the paper. Turn the top. Easily remove it. Are you you still doing okay?
Yes.
So now I'm going to set up the bag down here. Like this. Just making sure it stays below so the urine does flow. And then now I'm going to attach the leg strap to keep it in place. And then I'm going to cover him up. Then I'd remove the bath blanket, and then at this point as well, I would obtain a urine specimen if necessary, but we aren't doing that today. And then I would offer him peri-care as well if he needed it after, and if he needed anything else. And then I would lower the bed, and I would make sure all the wheels were locked, and collar was in place, and all of his belongings were by him if he needed them. But I'm not going to do all that because I'm just going to remove the catheter now. So I would walk in, I would confirm the patient's name and date of birth, I would ask him if he's allergic to anything, ask him if he was in any pain or if he needed anything like any pain medicine or anything like that. Put on some gloves. Perform hand hygiene as I did. So I'm just going to remove the blanket again. And I would also remove the bath blanket before I left, but since we are just removing it again, I'm not going to do that. I'm going to place a chest pad below. And I would, where's the cylinder? The cylinder's over there, but I wouldn't actually do this and touch everything. I would have it in place. So, perform hand hygiene, change gloves. I actually did do that. And then I would empty this. I would let urine flow all the way into here. Close it. And then I would clip it back into place. And then I would measure the amount of urine in there. I would measure the color, so like let's say it was light yellow and then there was no apparent odor. So I would dump this or discard it per facility policies, and then I would dispose of it as well as this. Change my gloves. Unhook this.
I like put my hand there.
Back here. Lift your gown up. And I would remove the leg strap. And then I would put this into here and let gravity deflate the balloon. And then as you can see, it's pulling back the water, but for the purposes of the timed video and staying under 15 minutes, I'm just going to draw it up. In real life, I would never do this. I would let gravity do all the work and not pull. Okay, take this, discard of it. Okay, Mr. Smith, now I'm going to be removing your catheter. Are you still doing okay?
Yes.
Okay. So I'm going to remove it as quickly as possible. It can be a little bit uncomfortable. So if you could just take some deep breaths while I do it. So I'm just going to coil, and then you did so great. I'm just going to dispose of all of this. Okay. Change my gloves one last time. I would offer care to him. Okay. And then I'm going to pull down this and then dispose of this and the dirty linens. Pull up the sheets. And then lower the bed. The lowest position, and then I would make sure the collie is in place, and I would make sure all the wheels are locked, all of his belongings were near him. And is there anything else I can do for you before I leave?
Nope.
Perfect. Okay,